some of the nation's governors take swift action to reopen their states, some health frontline workers are feeling blindsided, and as the Washington Post puts it, in complete disbelief. This says the overwhelming amount of medical data suggests reopening too early can cause a second spike across the nation and could be a double whammy, both on health and on the economy. Joining me now, clinical professor of epidemiology at NYU School of Global Public Health, Dr. Robyn Gershon, and emergency physician and president of Airway Cam Technologies, Dr. Richard Levitan. First, Dr. Gershon, I don't want to dwell on the president's disinfectant and bleach comments. But I want to ask, because that I would hope people realize you don't ingest bleach. I'd like to ask more about the study that they presented yesterday in this issue of ultraviolet rays, what it does to the virus, and whether that should impact our planning for the summer.
Well, clearly, UV works on a lot of viruses. It's been shown to work. It clearly can work on surface decontamination and sterilization. But for humans, it's totally impossible. Now, in some of these very large plants that you just talked about, perhaps there could be some utility in that setting. But in a clinical or public health perspective, that is just not going to be feasible.
And let's talk about the bigger issue of this idea of what the summer is going to bring. Does the summer essentially buy us some time and space because the spread will be slow due to help with the humidity? Or is it one of those things that we won't see much of the virus? It seems as if all the data suggests it's going to be around, just might not spread as fast. But what are you saying?
Look, we know that regular seasonal influenza does go down in the summer. A lot of that is that people are outdoors and not in such close quarters all the time. We don't really know a lot about this virus. We just learned a lot more this past few weeks from people like Dr. Levitan and others who are trying to elucidate the pathogenesis of this very unique kind of virus. I don't think we can pin our hopes that the summer will have a big decrease, especially as we start to see places in the U.S. open up. All those people can now leave the area where they are having a hot spot and go to any other place in the United States. And even though we have a lot of cases, of course, we now know from Governor Cuomo's survey, we have a lot in New York City where we're already perhaps immune. We have a lot more that are not. And all of us are now vulnerable. So it's, I think, foolish to pin our hopes on the summer.
Dr. Levitan, let me ask the question another way on the issue of reopening. Are hospitals, are emergency rooms ready for the country to reopen? And I ask that because right now the whole point of the stay in place was to give room to hospitals, give room, make sure we have enough beds, make sure we have enough healthcare workers. And we've limited other issues that emergency rooms deal with on a daily basis. Obviously, when you open up, everything comes back. You've been in these ERs. Are we ready?
So I defer to Dr. Gershon on some of the public policy issues, and a shout out because I also graduated from NYU. But let me just point out that a lot of people are getting the wrong message. They've been scared to death not to come to hospitals. And so we're seeing people who've had heart attacks, we're seeing people who've had strokes, seeing people who've had ruptured appendicitis, who are coming in late out of fear. And I think, unfortunately, that's a message we need to change, that people need to come to the emergency department for emergency conditions. And what I've discovered over the last month about this virus, my experience in New York, is that what we've learned in New York is incredible, and it is going to help all of America, and that I am much more hopeful about where we are as a country and our ability to fight this virus than I was a month ago.
Why are you much more hopeful? What gives you that hope? And I ask this, I think a lot of us are worried about healthcare worker morale if and when and a second round comes at us.
Yeah, so we are learning much more about this disease. We're learning how it silently can cause low oxygen levels. We're learning that we have a way to detect that. and that is, these simple, small pulse oximeters. But, better telehealth, better communication with your doctor, recognition of symptoms early, that shortness of breath is actually a late finding. But in addition to this, what we're learning is how to keep people off of ventilators. So in New York City, doctors, nurses, respiratory therapists, a friend of mine named Nick Caputo, another friend, Ruben Strayer, and I, we wrote the first article that is now out showing that simply turning people over on their stomach, giving them oxygen, can avoid ventilators. 3 out of 4 patients who we met in the emergency department with severe COVID pneumonia, 3 out of 4 did not require a ventilator in the first 24 hours. And over the course of their hospitalization, 2/3 did not get put on a ventilator. So this is dramatic because as this disease is something we have to deal with over, who knows, 12 months, 24 months, if we can move treatment of this disease to less ventilators, less resources, it will have enormous impact on how we go forward as a country.
All right. Well, knowing that there are best practices being shared in the medical community, that in itself obviously is reason for sort of pragmatic optimism, I guess is probably the best way to put it. Dr. Gershon, Dr. Levitan, I'm a bit short on time, but I want to thank you both for sharing your expertise with us.